I mean, there's a lot of good news in Kent County. We I have 8 therapists that worked out of our Easton office and for ESPS and send their kids to school in Kent County and are longtime residents. So they had a really good sense of what was and what wasn't happening in the county in behavioral health. Similar to myself, I teach at the college and I live up in Betterton Beach, and I have a tiny little private practice in Lynch, Maryland. At that time, we were doing a lot of listening and trying to figure out, what would be the most important and effective services here. Uh, and within the past year, not just ESPS, but a number of other agencies are here. Community Behavioral Health for all seasons, Kent Behavioral Health, and of course, Chester River Behavioral Health has been here for decades. So there's really good news for Kent County in terms of the provision of behavioral health services. I mean, national statistics are 1 out of 5 people has a diagnosable mental health. It's 21% of the population. That's true just both for children and for adults. And those same children don't grow up to continue to have a mental health concern. Some do and some don't. So 1 out of 5 of us really, could benefit from some type of service. With children, that 21%, there's a whole continuum there. But anywhere 6, 7, 8, 9% have, severe emotional disorders. And so there's a real need. I mean, shore-wide, ESPS has 4 locations. We see just about 4,000 people a year, and over half of them are under the age of 21. So we're really doing a lot of service delivery for for children and families. Our ESPS started with 3 women. The executive director, Kathy Seifert, and Sarah Hooper and Lynn Gavigan. They're still all executives with the agency in a little house on the side of the road in Route 50, and it's grown to about 130 folks. And we just opened our 4th office in Chestertown. What we've noticed is, in terms of mental health at least, people who might not have come out for services 10 years ago, maybe even 5 years ago, are much more likely to seek help now. For us, we're meeting the needs of everything from what we call the worried well, you or I with some problem in life, maybe grief or divorce or the loss of a job, some kind of adjustment that we need to make to that, to people who are living with chronic illness. The other part for us is that we're licensed not just for mental health with the state, but also for substance use. And that, of course, is a tremendous need in both Kent County and throughout the state and on the shore with the opioid epidemic. There's a few things that we're doing. One is that we have a grant to work in the Kent County Detention Center providing recovery services to inmates that elect for that service. And it's pretty robust. And we're doing almost 9 hours of treatment a week in that jail with 2 full-time counselors. And then the idea is when they are released, they're released back to the community, to link them with services either here or with one of the other agencies that I've mentioned, so that they have a smooth ability to try to achieve long-term recovery. And there's 4 big domains that we try to help people in. And this is how broad they are. We want to help people establish a solid home, healthy lifestyle and healthy behaviors, really feel part of their community, and have some sense of purpose. And those are the 4 domains of health, home, community, and purpose. And if you think that broadly about the lifestyle change that's needed for long-term recovery, you see why those kind of make a lot of sense. Our mission at ESPS is to provide effective treatment that empowers people and also empowers them for a healthy lifestyle and empowers them to change their communities. So, what everybody knows, for example, I'm an old group therapist, and what I recognize about being in group is it's not just the person that receives help that benefits from group, but it's the one that's receiving and giving that help. So the more we can empower people to be active and really active in citizenship and active in confrontation of things where there's disparities along lines of race or sexism or homophobia, the better the community will be at whole and the better people become as they participate.